22 to start.
Get going.
Yeah. So I have my tea for our coffee and conversation.
All right. So I'm very excited to be here. Dr. Lea Lis, and know a lot about body-focused repetitive behaviors. I know a lot about dealing with children, and I'm really excited to talk with everyone on this panel today.
And I'm thrilled. And I wanted just to say a little bit more about you too. So Dr. Lis is a medical doctor who is double board certified in adult and child psychiatrics. And she's been working with families since the beginning of her psychiatric career. And she's uniquely positioned to help patients and children that face many mental health challenges and live healthy lives. And during her residency at St. Vincent's Hospital in New York and New York University, she's got a private psychiatric practice and has developed expertise in working with all modern families of all types. And I'm so thrilled to have you join me today.
Thank you. Happy to be here.
And just a little bit about me. So I'm Ellen, and I'm with HabitAware. And I am also what I call lovingly a trickster. I don't know, for those of you out there who are hair pullers and have trichotillomania, you might not know, but we call ourselves tricksters. And I've been a hair puller since I was 11. And I'd like to start off our conversation with just sharing a little bit about how it all started with me. And then we'll have a conversation with Dr. Lis, and we're going to talk about more about these body-focused repetitive behaviors and how we can take control versus having them control us. So travel back in time with me, and it's 1976. And there's my dog who decided he's going to walk in. So we're going to close the door. All right, so it's 1976, and I'm out on the playground, and it's gym class. And I'm nervous because they're about to pick for teams, and I'm neither sporty nor popular. And so I'm playing with my hair, as I probably always did. And then all of a sudden, I just pulled one out, and it was like a zing. All of a sudden, I was like, wow, this feels really cool. And I had no idea that I kept going back and back and back to pull at my hair until my mom took me to the hairdresser. And so, you get there, her name's Fatima, I still remember, and she takes my hair and she goes like this and she goes like this, and she sees 2 bald spots behind my ears. And I'll never forget this. She calls my mother over, Sandy, come quick, Sandy, there's something wrong with Ellen. And that's all I heard was wrong. Something wrong with Ellen. She's got 2 bald spots behind her ears. Oh my God, what did you do? They look at me. What did you do? And I was so scared and I was so frightened. So I lied. And I said, Ancino, who was my best friend, put gum in my hair. And they were satisfied with that answer. And I was terrified. And I sat there and I let her cut my hair. And the minute I walked out, I said, I'm never going to do that again. And of course, that didn't work. And so I hid it. I hid it for years and years and years, and always just thought I was a freak, because why would someone want to pull out their hair? And then I walked into University of Maryland in 1983, and I walked into abnormal psych class, and there was a word on the chalkboard that said Trichotillomania, and I learned what the name was. I couldn't believe it. I couldn't believe that I wasn't the only one, and I was so thrilled. But then I still didn't know what to do. So over the years, I kept my secret. I hid my hair pulling. I saw a couple of really quack doctors who didn't know what they were doing. I also went to a group therapy that actually really helped me, because I got to meet other people just like me. And then the group therapy ended, and I went about my life, and the awareness is what tripped me up all the time, because I wasn't aware of when I was doing it. And once I would start to pull, it was so hard for me to stop. And I thought I was just going to live with this forever. Until May of 2017, after pulling for 3 hours, after binge watching probably This Is Us, and my elbow is hurting and my fingers are hurting, I Googled what's the latest breakthroughs in trichotillomania, expecting to find nothing. And I found the Keen bracelet, which is this bracelet that you train specifically for your gesture, and then it vibrates. And I thought, okay, it was invented by someone who grew up with this issue, and it had a 90-day money-back guarantee. So I decided to buy it. And when I did, at first it didn't work because it wasn't trained properly. But then once I hopped on a FaceTime and got it trained, it was unbelievable because I was able to get my awareness. And when I would come up here, it would gently vibrate, which I would decide was a hug on my wrist. And once I got that hug, I would pause and notice what was going on. And then I would put my hands down and do other things. And it slowly over time changed my awareness so that I could take over control. And since that day, I'm not 100% pull free. I don't think I ever will be, but I'm 95% pull free, which is good enough for me.
And you know, just to say that the most difficult body repetitive behaviors to get rid of are the ones that are unconscious, meaning like you don't even realize you're doing it. Like when you're bored or you're watching TV or you're even when you're stressed and doing homework but you're not aware. There are the people who get in front of the mirror and, you know, really pull out their hair in front of the mirror, and those are actually easier to deal with. But the Keen bracelet is really great for the unconscious pulling and picking.
Yeah. Yeah, it's and I wanted to ask you, Dr. Lis, you know, one of the things that you have in your name is the Shameless Psychiatrist. Could you just talk a little bit about that? Because I lived for so long with shame. And now that I have the Keen bracelet, I feel more empowered because I have my awareness. And I just thought it might be a good thing to chat a little bit about.
Sure. Well, I worked a lot with teenage girls, and one thing I noticed was they carried around so much shame about their sexuality, about their coming of age story, and so I decided that I was going to write a book on children and sexuality, and in that process of writing the book, I named it Shameless: The Shameless Psychiatrist Guide to Parenting. And now I changed the name to No Shame because there was already a book called Shameless. But the Shameless Psychiatrist stuck because I do a lot of work around, you know, living without shame, whether it just owning your story. And the book talks a lot about owning your sexual story, you know, whether you're raped, whether you were hurt, you know, how do you own your story and spin it to be a rational, you know, enlightened one, a wise story, and pass down intergenerational wisdom rather than trauma, because we pass down so much trauma to our children. So that's why I decided to name myself the Shameless Psychiatrist and think and talk a lot about shame. So
That's great. Yeah, because shame is something that just so many of us who have these behaviors, we feel so much shame because we think we're doing it to ourselves, right? Because it's our hands. You can't put away your hands, you can't put away your skin, you can't put away your hair. But if you can find your, and you know, when we talked before we hopped on, we were talking about how it all starts with awareness.
yeah.
But then once you have the awareness, you still have to do all that hard work.
Mm-hmm.
And I thought, you know, we've got a lot of parents on the call today, as well as kids that might be on the call today. And I thought it might be a good idea to talk about, all right, so now we're home and we've got COVID, which is so uncertain. We don't know when we're going to go back. We're doing all of this homeschooling, or we're the ones that are being homeschooled. We've got a lot of energy. Many of the kids who have body focused repetitive behaviors, and you can speak to this, probably also have some ADHD or other things, or we just have restless energy. What are some of the tips that you have for how to set up a homeschool environment so that parents and kids can feel empowered?
Well, I think it has a lot to do with what kind of kid you have. And I think if you have more of the inattentive ADHD kid, which incidentally does go along with a lot of tics and other bite picking disorders, you really want to set up a very structured home environment where, you know, you wake them up at the same time every day and you put a lot of reinforcers into their homeschooling program. So what that means is, you know, every day it's the same time: 9 o'clock math, 10 o'clock social studies, 1 o'clock science, 2 o'clock, you know, the rest of the stuff. And in those times that you're setting up the homeschooling, it should be based on content chunking, not time. So like, if you finish these 2 math worksheets, then you can have a break So they're really motivated to finish because they have a lot of problems with motivation. And if you just say, okay, we're going to do an hour's worth of work, after 10 minutes, they're looking to get out because there's, is really no reward for finishing it or being motivated to finish. So I would base it on content, not on time. And then, give them reward. So if you finish this, then you can have a snack, or if you finish this, then you can go outside for 20 minutes. Or if you finish this, then you can have one video game. I mean, you don't want to get caught up doing the video game thing all day, but one reinforcer of a video game. And that really works well for the ADHD kids. If you have more of the anxious kid, who just stresses out all the time, then you want to focus more on, the idea that you don't have to be perfect, that, not everything has to be checked over 10 times. You could say, hey, what would it be like if you just submitted it without, me looking at it? I think you could do it, and empower them to feel like they don't need all the reassurance. Like, you don't always want to give them all the reassurance all the time, because then you create more need for reassurance. So it a lot has to do with the kind of kid you have, but those are some ideas.
I'm glad you brought up about the anxiety, because, the kids have it. And someone had emailed me in earlier and said, I have a 10-year-old daughter, and even the small, littlest things are starting to trigger tears and just crying. And I know it's because it's so uncertain and she's so anxious. And is there something that I can do besides just supporting her and giving her a hug? So if we're finding that our kids are acting more stressed out, and things that wouldn't bother them are now starting to bother them, is there any suggestions that you have?
The first thing I would do is set up this idea of an experiment. Like, well, what would happen if you just turned in that assignment without me checking it over? Let's see. And encourage them to do it, and then say, oh, look, you still got a 90, or, it's like, okay, so you really didn't need all my help or my reassurance. And because a lot of times these kids are very clingy,
Yeah.
Another idea that I love is to schedule worry time. What that means is like,
Oh, that's brilliant.
Okay, you're worried right now, but we're doing math, and now you're worried about, the COVID virus, and it's distracting you from your math. So let's do this. Let's keep a running tally of everything you worry about. You can put it on their iPhones, you can put a list, and you can say, this is my worry list. And then, at 7:00 tonight, you and I, we're going to worry about all of those things at once. So if we can do anything about it, we'll come up with a plan. If we can't, we're just going to worry about it. We're just worry about it. We're going to be like, okay, we're going to stress about COVID. It's scary. We're all scared. We're going to stress about it for that half an hour. And then we're going to put it away. So we're just going to worry all at once. And that's really helpful.
Oh, I'm so glad you brought that up. I have to tell you a quick story that going along with that. My daughter, who's now 16, when she was 9, she was doing Girls on the Run, and there was a race, and she's like, super short. And she got so nervous because there was all these tall people around her. And she looked at me and she goes, I just can't do it. I'm so worried. I'm so nervous. And I said, I'll tell you what, give me all the worry. And I'm going to put them in my hand, and I'll put them in my pocket. When you're done with the race, then we'll look at your worries. And so she just, everything she was worried about, she said, and she just put them in my hands, and I put them in my pocket. The race was over, and I looked at her and I said, do you want to go through your worries now? She goes, no, I'm good. And I thought it was so awesome. And I'm glad you're saying that, because I think that can go far, not just for kids right now when they're worried, but also for us. I'll be working and I'll be wanting to do something. And then I say, don't look at the news, don't look at the news, don't look at the news. And I can't help it. And I go over and look at the news. So I'm going to start that and make a little worry sheet of what I want to do. And I'll do that when I'm done with my task, or at 7:00. So that's awesome. I'm so glad that you brought that up.
Good. I'm glad it was helpful. So.
Yeah. There's Aneela, is there any questions that are coming up that you're seeing that we should address? I just want to.
Yep, I've sent a couple directly to you, but there's one who's from a therapist. So they have a teen patient who tends to pull when they're anxious. She's preteen and oftentimes finds herself pulling and triggered when thinking and talking about growing up. So she's had a lot of shame about starting puberty early. How would you address and help her? Do you have any strategies?
Sure. One strategy I have, I don't know what the parents are like and if they're really on board, but one strategy I would love is to create a ritual around puberty with the parents. So the mom, the female members of the family can get together, take her away like for a camping trip or a day. Even if it's just a day where they all get together as women and they write her letters about what it means to become a woman. They talk about, what it means to be a nurturer, what it means to embrace your sexuality, and what being a woman means to them, and really creates a ritual around the transition between becoming child from a child to a woman. And I think that creates a lot of acceptance of the process, because a lot of times they're worrying because they don't know what it means and they don't understand it. So just having that time with the female members of their family, or friends, extended family, and having that this is what it means to become a woman. You get to nurture, you get to have your own home, you get to provide for your family, you get to have sex, which is really a fun, amazing thing. When you get older, you get to have your body changes, but it becomes stronger. And so that creates like a lot of acceptance and brings down the fear. And also I always say it's fun to do it with only women, but I really think men can also get involved by writing letters too. And that can be read during the time. Like a father could write a letter to his daughter about what he hopes for her when she becomes a woman, stuff like that. Really self-esteem building stuff that I love. So that's one idea. And the other idea I have is to sort of do a little bit of exposure work, where the girl to the therapist, the girl discusses all her fears while doing some calming, some breathing and all that, and then discusses her fears over and over and over and over again in multiple sessions until the fears don't bring on a somatic response, doesn't trigger your adrenaline system.
Those are great. That's really great. And the other thing I wanted to add to that was just because I am a hair puller. So we have the restless hands. So there's a reason why we do this. And so we might pull, or we might pick or bite because we're anxious, because we're nervous, because we're concentrating, because it calms us down. So for this young lady, if she's nervous about puberty coming on and then she's grabbing, one thing to do is, if she's aware and she's noticing that, is to begin to play with other things instead of your hair. So for example, I have a couple of things. I call this my pause pack. So it's a pack of my things that I just love, with that when I catch myself as if I'm playing with my hair, I'll grab something out of it. So I have a fur ball that brings me joy that I love to play with. And I have a purple rock. And I have these awesome hair ties. And I also like them because they look pretty and they can go with my bracelet. So when we find ourselves picking or pulling, we have to do a couple of things. We have to replace the unwanted behavior with something that's much more healthy, which could be playing with something else. It also could be drinking a cup of chamomile tea, or it could be deep breathing. Because one of the things I like to share with people is our hands and our skin and our hair is always with us, but so is our breath. And so if you can take 3 long, deep breaths, it can slow down your central nervous system and help you feel a little bit more relaxed and taking the edge off. And then the other thing I read about recently that I've been doing that's been helpful is putting my feet on the ground, feeling my feet. I never think about my feet, but right now I'm thinking about my feet. And I'm feeling them, and I'm saying, and they're more support. I'm being grounded by the floor, and then my whole body feels a little bit more grounded. So I think and it's not one size fits all, and it's not one thing that's going to do it. You have to do a variety of different things.
I really like to give the child ownership over what might help. So I love Ruta Chakra Beads, which are Tibetan braid beads, because they're like these great wood kind of really sensory beads. So some kids like that. Some kids like, different kind of fidget toys. Some kids like those squishy things. Some kids just, like to sit. They put their hands right in between their thighs. you know, and they kind of sit on their hands, because it's just that minute of, okay, I can't, I can't move my hands for a minute. And some kids benefit from that as a, you want to replace the maladaptive habit with a better habit. So those are some examples.
Yeah, yeah. And I see a question that just came in. This is so common. Where the 10-year-old pulls eyelashes when she gets bored, and it especially happens at bedtime. And I know for me, a lot of the times that I would go for my hair is when I was bored. And also at bedtime when I was just calming down from the end of the day, or as an adult for carpool, when you get in the car and there's no one else there and you're driving to school, which we haven't done in a long time. But when you're doing that, you're all alone, and you can have times where you're going to be pulling or picking. So again, some of the best things to do is, one, that if you're aware of that when you're bored, that it's happening, is to have other things around that you can play with. And also to assess what's going on at that moment. So if your child is, let's say it's 2:20 and they're done with their online school and they're bored, if it's 2:20 in the afternoon, well, maybe they should get up and do jumping jacks, or maybe they should do a puzzle, or maybe they should go outside and do a quick run around the block, something that's going to stimulate them versus playing with their hair. But at the same time, if they're bored and it's 10 o'clock at night, and they're starting to pull, maybe they should just go to sleep. And then when they go to sleep, sometimes having other things in the hands versus the eyelashes, or playing with their eyelashes, can be really helpful.
Yeah, that's where you might get a blankie or something soft, or some kind of, stuffed doll, or something that can replace the eyelashes in terms of soothing.
Yeah. Aneela, is there any other questions that have come in that you think we should be addressing?
Yes, there are a couple. I'm trying to feel them as best I can. So anonymous attendee wrote in, and I'll just read the whole thing. I do think I'm mostly aware because I like the feeling, but I do know I subconsciously reach. I feel like a lot, I find it hard to stop because even though I notice and I know it's bad and I don't want to, and it's hard to tell myself not to. What should I replace? How do I reward myself for stopping so that I don't give up and just pull because it feels good? And what loss is one hair? I've tried hats and gloves, but they are so itchy and don't help and are more of a nuisance. I also have the bracelet, but it's still hard. I would love to take this question, but Dr. Lis, if you want to go first.
Oh, sure. I was just going to say that you have to replace one habit with another. So it's really important that you find something that stimulates you. Find a sensation, a stone, something that you can wrap in your hands that gives you, and I would recommend something that has a little, I want to say a little, not pain is not the right word, but depth to the so that when you touch it, it creates a really strong sensation. So something with grooves or knobs, or, nothing smooth. And then, that might also help get the feeling that you're looking for. Or, you might be one of those people who needs a little bit of that sort of pain or sensation. So you can actually snap a rubber band on your wrist. It kind of just jolts a little bit your sensation, and kind of jolts you out of that space. So those are some ideas that I have personally.
Aneela, did you want to?
So I would just say here, the person who wrote in wrote, what loss is one hair? I agree with you. Like, I'm 95% pull free, I would say. I can't actually mathematically quantify it, but I will catch myself pulling 2 hairs, looking at them in my fingers and saying, nope, don't want to do this. I'm aware enough. And again, using those strategies, which you really need to figure out for yourself what is right for you. We can give you lists and lists day in and day out of ideas, but until you practice them and experiment with them for a day or two and say, oh, I don't really like that stone idea. Oh, I like the rubbing my hand with a brush idea. I like the getting up and drinking water. I like the stretching. I don't like deep breathing. Like, I've had someone say deep breathing makes me anxious. Like, trying to sit and do deep breathing makes me anxious, which scientifically, not sure, don't understand her statement, but I get it, right? You have to find the thing that works for you. So I would say
it's also like diet, right? Just because you gave in and ate the piece of chocolate cake doesn't mean you need to eat the whole cake.
Exactly.
So, you could say, okay, I pulled, I see the hairs, I put them on the table, I look at them and say, okay, move on next. And then, but I don't need to make it worse by pulling 100 hairs. So, you can just examine those 2 hairs and say, that's good enough for today, and be forgiving.
Exactly. Yeah, that very first part, that forgiveness and kindness to yourself is paramount and speaks so much to what Dr. Lis is doing with talking about shame, right? Shame is the antithesis of kindness. And how do you pull yourself out of that hole and just love yourself? And the more you tell yourself good things about yourself, the less and less you feel the need to pull, I think. I think they kind of work cyclically.
Yeah. And I'm glad you brought that up, Aneela, about being good to yourself. And this is something that we can do, all of us, no matter if we're pickers or pullers, is write down or think what are 3 things that you really love about yourself. And maybe what you love about yourself is your sense of humor. Maybe what you love is your strength and your creativity. And then for parents who are watching and they see that their child went to sleep with eyebrows and then woke up with half an eyebrow missing, they can focus so much on that eyebrow. But I would challenge you and suggest focus on the things that you love about your child. Because the thing you love about your child is not their eyebrows. The things you love about your children are going to be their sense of humor, their creativity, their laughter, their ingenuity, the way that you see them running around with the dogs and other kids. Those are the things that we love about our kids. It's not the hair and it's not the skin. So sometimes you need to fake it till you make it too. And thinking about what you said too, Dr. Lis, where you might have 3 hairs, you're like, there's 3 hairs, I'm not going to continue, I'm just going to stop and I'm going to be okay with that. I've also heard, which resonated with me. So let's say you're walking down the steps and you trip on 3 of the steps and you catch yourself. Woof, thank God I caught myself on those steps. Because you tripped on 3 steps, are you going to throw yourself down the rest of the steps? No, you're going to just then gently walk down the rest of them. So if you catch yourself pulling 3 or 4 hairs or picking off a scab, instead of saying to yourself, well, I started, I might as well just do the whole thing, you can decide that you're going to pick yourself up and then do something that's healthier and walk down those steps instead of throwing yourself down.
And it's also challenging the distorted thoughts. I know a lot of people with trichotillomania are always searching for like the perfect hair. It's got to feel exactly the way they want it to feel. It's got to meet some criteria, be coarser than others and all of that. And it's also about challenging those thoughts. Like, I don't need to find the perfect hair, this idea that it's like it's going to give me some relief. Feel like then you can challenge it and say, it's not going to give me the relief I think. It's not going to really solve any of my problems if I find the perfect one. I need to, distract and refocus. It's talking back to the thoughts.
Yeah, that's a good one. Those false beliefs. And I know with skin pickers, a lot of the false beliefs could be, well, I have this blemish and it's a bump. And if I could just smooth that bump over and get rid of it, it's going to be great. And
I do have a lot of skin pickers though, who have to, they have to maintain their skin very meticulously because once it starts, they can't stop. So like they have to be very fastidious with their nails, which I recommend that they do. I have a lot of the beard pickers who have to keep their beards very, very short on men. So they don't start something and then they can't, they have to maintain their hygiene so they don't start picking at acne, so that actually does help too. And also, if you're in the beginning, there was a question from a conscious picker or puller saying, how do you deal with that? And if it's very, very conscious instead of unconscious, like that you pick your hair in the bathroom in front of the mirror with a certain mirror with certain tools, you have to make that mirror and tools hard to find. You don't keep it out. So, you want to, lock it in a lock box. So it takes that more, your nail file or your whatever, your tools. So it takes that much longer. You really got to want to do it. Right. Or get rid of that mirror that you always use. So you make it more and more difficult to, do it quickly.
Yeah, I agree with you. With some of the other things on that same vein with the people who are conscious pickers and they go in front of the mirror or pullers is to put dimmers in the bathroom so that you have a dimmer in there because it's harder to pick or pull if you can't see yourself. The other one is to take a pillowcase and put tape on it. And so as soon as you walk into the bathroom, you cover up the mirror. and so that you can't look in the mirror. And another one that I've been suggesting recently is to get a timer, like an egg timer, and leave it in the bathroom and set the timer, especially for kids, and try to beat the timer, because you don't need to be in the bathroom for 45 minutes. You really can just be in the bathroom for 10 minutes and try to come out.
Those are good. Good.
Yeah, and I had another person who put all their art on their mirror. So they made their own art and put it up there. So those are some of the other tips for those pullers and pickers that are active. And then with the tweezers, you're right, lockbox. And here's another one that you could take a Tupperware and fill it with water, stick the tweezers in it and freeze it. So then you have to defrost the freezers before defrost the tweezers before you use them.
That's a great idea.
So I have another question that's very much tied to coping with COVID right now. The person writes, I'm a college student with Trich, finding online school to be quite painful in terms of focusing and actually taking in the content. I was starting to make a lot of progress with handling my Trich before COVID happened, and I believe I'm starting to get back to pulling more often. I have to keep changing my hair part to hide it, but it's so hard. I have the Keen bracelet, meds, therapy, and my friends helping, but I feel stressed about this time of uncertainty. Any advice? So Dr. Lis, this is like
right up your
alley.
alley.
For you.
Yeah. Well, I've been talking about this for weeks now with everybody, which is how do you tolerate uncertainty? We, especially young people, I don't know the age of this person, we are, never experienced uncertainty like this, before. And we're all experiencing it in various ways, but how do you tolerate uncertainty? And the reality is you got to talk back to it. You have to do the cognitive work, which means like you could walk outside right now and get hit by a car and die, right? Life is always uncertain, right? COVID is no different. Like, yeah, we could get sick. Our grandma, that's a terrible thought, right? But you have to forget what is possible and focus on what's probable, what's probably going to happen. And the probabilities are you and your family will stay safe. The probability are, even if you got COVID, you would recover from it. And the probability is that it will be a hard year for all of us because homeschooling may continue, but, we will still be able to get educated. We will still be able to eat. We will still, be able to live and function pretty well. So focus on the probable, push away the thoughts of the possible, at almost at all times. If you need to, you can schedule that worry time. And then when it comes to, okay, I have to study, but I'm so caught up, you got to really put out the world, right? Because you got to focus. So, put on there's something called, there's an app you can put on your computer and your phone that blocks all your messages. So you can't look at your phone or whatever until the timer runs out. So it's great if you're trying to study. So once you press it, you have a half an hour where your friends can't get through and, you can't search the web if you're writing a paper. And that's useful. You got to block out the world. You turn off the news. And I loved, again, to content chunk. So really reward yourself. Like if you're a student who's, homeschooling, you say, okay, I'm just going to finish this chapter. I'm going to say, I got the whole day to study, just say, I'm just going to finish this chapter. I'm just going to finish these 10 questions. And then I can take a break. Then I can go outside, take a walk, whatever. So content chunk and reward yourself personally. Like I'm going to reward myself with an ice cream, or I'm going to reward myself with a walk, or I'm going to reward myself by watching a funny YouTube video. That's what I do with my taxes because I hate them so much. I say I'll do 10 minutes and then I take a break. Then I'll do another 10 minutes and then I'll take it. Otherwise I can't get through it. It's just like torture. So,
that's great. Great advice. There's one question here that came directly to me or to the panelists that I wanted to read out. So what do we think, you and I, about parents taking pictures of missing hair spots every time the child pulls? Or is there another way to keep track? And I will tell you as a hair puller that would...
that's shame. I feel like so much shame in that.
It would completely frighten me, and it would make me feel so shameful that if I woke up or my husband or my mother said, oh my God, look, you have, this is how much bald spots you have, to show me my behavior. I believe, and I'd like to have your feeling on this too, is that you need to track the effort not the result, the effort of what you're doing in order to try to stop picking and pulling. So the effort is wearing a bracelet. The effort is playing with another toy. The effort is putting your feet on the ground, putting on a hat, going out and taking a walk. All of the effort that you're putting in to create healthier behaviors is what you want to reward.
Yeah, I would recommend that you use a picking or pulling journal where I have one actually, I could post it, but where you do like the antecedents to the behavior, the actual behavior, where you were, the time of day, and what strategies you used, and, keeping those journals, and then having the parent reward the journal writing as well. Like you say, okay, if you, really keep up this journal, and every time, you do it, write in this journal, and I'll reward you, I'll buy you a present or a toy or a prize. And so you can really focus on the positive instead of focusing on the result.
Yeah. Yeah. And the other thing, if you do have a bracelet, you can also track that way. So what we do with the Keen bracelet is, if you come up and you do your behavior, it vibrates, but you also pull, then you just non-judgmentally press the button on the side of the bracelet. It's just like a tracking on an app, and then it automatically tracks for you. So with kids, then you can look at the streaks and say, gee, on Monday you did 40, on Wednesday you did 30, on Friday you did 10, and then on Saturday, wow, it's 60. Let's take a look at what happened on Saturday, just to see how we can help adjust things for you. And you just do it in a non-judgmental way.
Yeah, that's all great ideas.
Yeah. Yeah. Aneela, anything else out there that we haven't?
4 questions for you. Y'all, and we get some good time. Okay, so this one comes from another attendee. Hi, I'm living with dermatillomania since I'm a kid. I'm now 25 and also have group coaching to help. But since COVID, it's so much worse. I'm hoping my bracelets will help me to stop. I've tried blockers, gloves, band-aids, stress ball, Dollarama toys, breathing exercises, meditation, Post-its with my dermatillomania thoughts from negative to positive. Is there something else I can do? I've heard alimentation is also a factor, but sometimes I just feel hopeless about my behavior.
Well, I'd like to mention just one thing, since this question person has a bracelet. One of the things that really made a huge difference for me, and actually taking a step backwards, sometimes it's, okay, we have a bracelet or whatever it is, it's going to give us the awareness. And now we're aware. We have the awareness. So now what? And so one of the things that I did when I first began wearing my bracelets and getting the awareness is, instead of being upset with myself when I pulled, when I got that vibration, I associated it with a hug on my wrist. So instead of thinking, oh my gosh, what is wrong with me? I'm the biggest loser. I can't stop. Why can't I stop this? I'll never be able to do anything else. I can't do this. If I can't do this, I won't be able to do anything else. Whenever I got that vibration, I decided it was a hug on my wrist telling me, hey, Ellen, you are a rock star. You are now strengthening your awareness muscle. You're aware. That is huge. Put your hands down and notice. Just pause and notice what's going on and what can you do that's more healthy instead of the unwanted behavior. And I would do that time and time and time again, that actually over a period of time, I became so aware that I realized, wow, I haven't gotten the hug in 3 hours. And I just came up here just because I wanted the hug. So sometimes you have to really work at making a mind shift in order to go from a fixed mindset, I'll never be able to do this. I'm not good at this. I'll never be able to stop, to a growth mindset. Well, I'm not able to stop while I'm in front of the TV yet. But what can I do? What have I learned from knowing that when I sit in front of the TV, I'm automatically going to do this? And as you begin to make small changes and small successes, success breeds success, which breeds success. You can continue to make small changes. Dr. Lis, do you want to add anything on to that?
Yeah, I want to say that I didn't catch your name, but whoever it is, I have to say you've done a lot of really wonderful things. And I think that you've really worked a lot of the different programs that are available. Some, sounds like dialectical behavioral therapy, meditation, all these different things. And I want to say, well done, you. I think this is a time for radical self-acceptance, which is that this is a really stressful time in everybody's life. And you may engage in more maladaptive coping skills, and just forgive yourself for it and let it go. This is a very strange time. you know, unless you're in the hospital because of skin infections, you know, or something really horrible, maybe it's time just to be a little more accepting of, you know, the fact that you just need this right now and you can't change it. You're paralyzed to change it. Same thing I would say to someone who's overweight, who is, you know, says they just can't lose weight right now because they're too stressed. I would say, well, it's okay. It's the middle of COVID. Like, so what? You put on some pounds, you hurt, you know, you do things you don't really love about yourself. Let's just let it go and just accept that this is a tough time and that you have some weaknesses, and that's okay. So just forgive yourself, and it's just going to be something to accept for now. And when things get better and you're not as stressed and life gets back to normal, then you can work on it then.
That's great.
That's really, really helpful to kind of give yourself that permission to decide whether or not to focus on something. The only thing I'd add is to this specific question is when you say you've tried everything, my question back would be, are you trying, it's very much in the moment related, right? So if you're doing the behavior when you're bored, then yes, you want to probably use a stress ball. If you're doing the behavior when you're tired, a stress ball may not be the right thing. You may want to just go to sleep. So I think Dr. Lis said it earlier, like use the clues, like ask yourself when you were talking about the journaling, like what were you feeling? What were you doing? Like use the clues to identify the best replacement strategy for that moment. So that, yes, you may have tried some of these things, but if they weren't for the right moment, then they're not going to really give you that soothing feeling that your brain is seeking. So I'd say maybe go back to that list and then just try to use them again, but try them at the right times and see if maybe something works. But I also really love what Dr. Lis just said about radically accepting this time and giving yourself permission to do what your body and your mind need to get through this time.
Yeah, I think we have to ignore everybody out on Instagram that are making their own sourdough starters. Right? There's so much pressure right now we're at home, where it's COVID. Now you need to become an artist and you need to become a chef and you need to have the cleanest.
Your kids. I mean, I'm radically self-forgiving myself for how lousy of a job I'm doing tutoring. And I'm like, you know what? They're smart. If they don't get every assignment done, they'll learn it next year. You know, like I'm not a teacher. I'm not going to be a teacher. I'm a psychiatrist. And so I'm not going to try to pretend that I can do what the teachers can do. I'm not going to try to pretend that they're learning as much as they would in school. They're not. And that's okay. They'll survive.
They will survive. And they're not alone. It's the entire world. It's not like you're the only one out there. Everybody out there on this call, you're not the only one out there that is struggling with these issues. You're not the only one out there.
I'm not going to get up and try to learn the clarinet. That's just not helpful. So forget it.
I might try to learn how to watch 2 television shows at once. That's what I might do. But I'm not going to learn the clarinet, and I'm not going to learn how to make sourdough bread. And we have to laugh, right? That felt so good. That felt good watching you laugh, and it felt good laughing. Mm-hmm. We need to do that. We need to do that. So we have about 15 minutes left. Are there any other questions that you guys are dying to ask us besides how to make sourdough?
I have a couple waiting in the wings. So one, I think I'm going to guess it's a parent, wrote in saying, Dr. Lis, what about preteen kids with early hormones who want to pull up pubic hair as a way of denying growing up? She does not want to celebrate her growing up at this time rather than wants to remain a kid as long as possible. So I think a lot of what you'd said before still probably holds true here, but if you have anything else around that.
Well, you got to convince them that growing up is awesome. You got to really sell them on it. Become a used car salesman for growing up. First of all, you know, I'm a big fan of I should say, challenging the cultural taboo around nudity. So I think a lot of kids who fear puberty have not seen an adult male or female naked body. And so I think that allowing your child to see you as a mother naked, see what your body looks like, how the hair is, how, you know, so that because a lot of times when a little boy or a girl comes up to their parent who's naked, they run and they hide. You know, they run into the bathroom and shut the door. And the kid's like, why would they run away and hide? What's wrong with their bodies? You know, I don't think they know how to handle that. So I really love the idea of like allowing more nudity in the home in a safe way, obviously, not in the middle of, you're not going to cook in the kitchen naked and get oil splat all over you. But if your kid walks in on you in the bathroom, in the shower, are you really going to slam the door in their face? I think that you could allow that. Maybe she's shamed because she doesn't know what a body looks like, and then she's never seen it. And to say, to allow, to shower with your daughter, wash her hair, as a mother, and, talk to her about your body and what you love about it, like what your, say, these are my breasts, these are my nipples, this is what they do. The hair protects, my vagina from things coming in and bacteria, and this is why my body looks like this. And, I love my body, and my body has allowed me to dance and sing, and, and be, have babies, and my breasts have allowed me to nurse you, and that's been amazing. And I cannot wait for you to have this body that I have as an adult, because you can do so many great things with it. And so it's like to reduce the body shaming, because clearly there's a lot of shame if she doesn't want to grow up around growing up. And I don't know where that came from. So that's something. And then you have to ask, what do you fear? Like, ask a lot of questions. Why are you afraid of growing up? What about being a parent or being an adult scares you? What about having breasts scares you? There might be like some gender dysphoria. There might be, I don't know what's going on there, fear of, their gender, becoming a woman, or I don't know. I'm guessing, but you got to really delve, really deep dive into the questions as to why they're afraid.
Yeah, that's basically with everything. You have to dig deep to the why, and then ask why to that answer, and keep going until you can't answer a why anymore. And that's really the root of whatever's happening.
And being excited, and showing them to be excited to be a grown-up, or be excited to go. Like, there's probably kids out there that are fearing, I'm going to be going to college at some point. And what, that can be very fearful, that you're leaving home, and to be super excited for them. It's so important. I'm so glad that you brought that up and the way you answered it.
So in the chat, there's another question. My 11-year-old is a puller. I have offered to buy her a phone, which she wants really badly, if she quits. She says she has quit, and I believe the hair is growing back. Is this an okay way to handle this? So Dr. Lis, do you have thoughts on like the reward mechanism?
I think that it is a great thing to reward positive behaviors. The question I have is, have you given them enough tools? Like, you can't just be like, hey, I'll give you an iPhone if you stop, picking your skin or your hair. It's kind of like, oh, I'll give you an iPhone if you write a dissertation on, Kant's philosophy of, existentialism. They're going to look at you like, huh? So I love the idea. It's a great idea, rewards, but are you really giving them the tools? So if it were me, I would, either get them therapy or read a lot of books and come up with a strategy and reward them for each. Like, I give you $5 towards the iPhone here, and another $5 here, another $5 here. Like, break it down, because I think you're asking too much of them. So.
Yeah, I would echo that too. And then what happens if, with these behaviors, they can come back. So let's just pretend that, yep, she's not pulling anymore, and she has not pulling, and you get her the phone. And then in 6 months, something happens and she starts pulling again. What are you going to do? Take the phone away? And then, there's a whole nother webinar on that. But so you need to give them the tools, and so that they can control it. And I like to say, and you said this beautifully this morning, Dr. Lis, we're saying you can't just say stop. That's like saying to your kids, stop being hungry. It's impossible, right? Because it's a biological thing. And I like to say, my mother is diabetic. She became diabetic type 1 at a late age, 65, which is a whole nother conversation. She'll always be diabetic, but she can control it with her diet, insulin, and exercise. But she's never going to have a diabetic-free day. And she's good. Some days her sugar might be a little higher, and some days it might be a little lower. But for the most part, she's pretty steady because she's got her tools. She knows what to do. And it's the same thing with hair pulling and skin picking. You have to have the tools. And everybody might use different tools and have different levels of insulin that they need and different levels of exercise. Other people have different levels of what they need for replacements and awareness. But they're always likely going to have this disorder. They just need the tools in order to manage the disorder. So Aneela, any others out there?
I have one more question. How can one overcome the obsession with perfection that seems to fuel the behavior? I have bitten my nails since childhood. also I have some checking OCD and mild hoarding paper avoidance. So it's really about around that obsession with perfection and how do we learn to be imperfect, to be okay with being imperfect.
I have some stuff to say about that. I think that that children really need to look at their self, their beliefs, and look if their self beliefs are distorted. So in this case, you've got a perfectionistic need for perfectionism, and this idea that unless you're perfect, that you won't be good enough, or you won't be accepted, you won't be loved. So you really have to look at those beliefs and say, is this perfectionism helping you? What are the positives of it? Like maybe some of the positives are it drives you to get good grades and, to do things. But then there's so many negatives, right? The negatives are unforgiveness if you get an 80 on the test, or, and this need for perfectionism makes you want to have control over things. And that's why you might pick, and that's the same paradigm in anorexia, this need for control. And this idea of like, I'm going to learn to let go of control because I'll never be able to be perfect. Life is full of, look at COVID, right? Full of things that we cannot control. And you have to learn to be okay with that. And I would say even go as far as marinate in it, like just marinate and sit with the idea of like this loss of control and learn to just breathe through it. So, I don't know exactly the examples, but, sometimes I'll tell like an OCD kid or someone who's very perfectionistic, fail a test on purpose, like just bomb a test, get a 20, fill it out completely wrong and see what happens. Does the teacher freak out? Does she yell at you? Does she slap you in the face? No, like, you make it up on the next test. She probably throws that grade out anyway, because it was the lowest of the, year. And, she knows you're a great student. Nothing bad actually happened. The sky didn't fall. So it's challenging these beliefs around perfectionism are really important. And incorporating new ones, such as, it's okay to fail, failing can be our greatest teacher, things like that.
I'm writing that down.
Yeah, I'm making notes in the chat for anyone who's noticing, just because that's how I'm visual. So I have to translate whatever I hear to the visual, and it sticks with me. So hopefully helping others do the same. That was really powerful. This whole perfection stuff rings true to me because it's how I grew up, and I can see that I'm transferring it to my 6-year-old right now. And I need to, everything you just shared has been super helpful for me that I can now take back and go apply when I go upstairs. So thank you.
You're welcome.
Yeah, I think it's really important and it's powerful to challenge beliefs. And it's also powerful to know that we're supposed to fail, because otherwise, how do you learn if we don't fail? I get nervous before I'm going to hop on a webinar, and I'm going to make a mistake. And my last webinar I did, I forgot to hit the recording until 10 minutes in. But you know what? People still showed up. People still loved it. It was still okay. And there's a solution for everything. So we're going to re-record the beginning half of just what I missed. So I think a lot of times too, people will think, I can't do this. They have this limiting belief. They make excuses. Well, I can't I can't hold on to a rock. I have to pull my hair instead. And I think sometimes excuses is just the decision not to solve a problem. We're not ready. And
yeah, I like to quote from Yoda, do or do not, there is no try. Because like I always tell my kids, like, you didn't do your homework because you just really just didn't want to do it. And that's okay. Like, you didn't want to, and you didn't exercise that day because you really just didn't want to exercise. So instead of beating yourself up for not exercising or not doing the homework, you just say, you know what, I wasn't in that place. There's always tomorrow. You either do it or you don't. If you do it, great, reward yourself. If you don't do it, let it go, move on. It's just, don't live in this space, should, could, would, the should, coulds, woulds. Gets rid of the should, could, woulds. Either you do it tomorrow or don't do it. Don't should, don't would, don't feel guilty. Just always understand that you're trying your best at every moment. And sometimes your best is not doing it because you need a break.
I think the shoulds, woulds, and coulds are going to go with that sourdough starter.
Yeah.
That's where they're going to go. So we just have a few more minutes. So I was thinking if there's any other last minute questions out there.
I have one question, but I just wanted to read one. Someone in the chat just wrote, I am now in my mid-20s, but I'm finding out so many unanswered questions about my own growing up, and it feels so empowering. I just hop on this call to get tips on Trich, but I've gotten so much more unexpected value. Thank you. So I just wanted to highlight that one to the two of you so you know that you're doing some really good work right now by helping all these folks that are on. And someone wrote in, how are you dealing with this difficult time? So I think Dr. Lis, you shared a little bit about your kids and having to homeschool them, and
how am I doing? I am doing, you know, some days I'm great and some days I'm not. I'm a very social human being. This is really rough on me because I miss my patients. I miss seeing them. I'm tired of looking at a webcam, and I miss playing with them. And I had to throw out all my toys. I think I cried when I threw them all out because I realized I can probably not put them out for another 2 years. I mean, what am I going to do with a huge thing of Legos? All the germs all over the Legos. You know, cried when I threw out the Legos, and I realized that that's gone. That is, you know, this is going to be the new normal, the screens. And when they come in, I'm going to have them hit 6 feet away. And, you know, I'm sad about that loss. It's a loss to me. And I'm thinking about how do I reinvent. So now I'm thinking about, okay, so I'm not gonna be able to have parties. I'm not gonna be able to go to weddings, you know, all the things I used to love to do. So what can I replace it with? So I'm thinking about small group events and learning, you know, having a group of my girlfriends learn to meditate or learn to start a book club, or, you know, and I'm trying to get excited about the new things that I can use to replace the loss. But and I'm grieving for a lot of the loss that, you know, and I'm grieving for New York City, because I was trained in New York City at St. Vincent's, and I was the closest hospital to 9/11 when the towers went down, and I watched all those people walk up the street like zombies and come into the emergency room. And this reminds me a lot of that in New York. I think there's such a trauma, but there's also such a solidarity, you know, with everybody cheering at 7 o'clock at night. And I try to focus on whatever positive things there are. And I only allow myself to watch the news like one time a day, and that's it. Otherwise I'll just go crazy. So.
Yeah.
Thank you for those tips. Yeah.
Yeah. And I'd like to come to the book club and the meditation club.
Yeah. I'm not watching any news. I'm just getting whatever news I get from my friends who let me know what's going on. I figure if I need to know, the information will get to me. Otherwise, I'm just focusing on my kids, my work, and myself right now, so that I can use this time to just, learn to be a better parent, learn to find time to paint or write, or just do the things that bring me joy right now, because that's all we can do right now, is to try to use this time as best we can.
Yeah. And I find that my emotions will go up and down, and I feel every single emotion I think there is throughout the day. And I could be happy 1 minute, and then 15 minutes later, I'm so depressed because, like you, Dr. Lis, I'm mourning that I'm an extrovert, that I can't go out and see my friends. So I'm trying to look for different things that fill me up. What fills me up? Because if I feel filled up, then I can help others. And I realize music is one of those things that fills me up. So I've been listening to NPR's Tiny Desk Concerts, which are so fun. And I get them online, and I'm seeing bands that I love, like Coldplay, amazing. You got to go watch the Coldplay one if anyone likes Coldplay. And then I'm learning and finding new music experiences, which are awesome. So when I'm feeling really down, I actually stop what I'm doing and I put on some music, and that's what's helping me.
Is doing free. There's free simulcast every day, which are beautiful. So yeah, there's a lot of great stuff like that going on. So yeah.
Awesome.
Well, this has been really great. I can't thank you
all.
Yeah,
there's a lot more tips on my website, shamelesspsychiatrist.com. I've been writing prolifically about the quarantine, and so it's all on shamelesspsychiatrist.com. I write for Psychology Today, and I write for Thrive. So there's all those articles. I've been writing about the quarantine. So check me out on that. And it's been a real pleasure.
Oh,
Yeah,
yeah.
and
Do
here's-
you want to pop up the slide?
Is it not up there? Oh, I thought I did. Is it there now?
And yeah, if anyone wants to take a quick screen grab of that, that way you have Dr. Lisa's information. Also remember shamelesspsychiatrist.com.
And Dr. Lea Lis is the same. It goes.
Oh, okay, perfect. So yeah, Dr. Lis, thank you so much. I learned a lot as a parent and as someone with so many mental health issues. I can't even count them anymore. I feel like every week I'm like, oh, I have that too. Like, so like the person whose quote I just read out, like learning a lot about my own journey right now. And I really appreciate your time. And so many folks have been in the chat saying the same, saying thank you for all the value you've just provided.
You're welcome. My pleasure.
And lastly, if anyone needs help training their bracelets or has questions, you can email me. And thank you, Dr. Lis. It was
You're welcome.
It was so great. So
You're
great.
welcome.
Let me know when that book club's starting.
Okay. Take care. Bye-bye.